Okay, 12 minutes to go. Turnout gear. Turnout or bunker gear is designed for use in structural firefighting. Head-to-toe protection, layers of fabric or other material to provide protection from the heat or fire. It reduces trauma from impact or cuts to keep water away from the body. Like most protective clothing, turnout gear adds weight, reduces range of motion to some degree. The exterior fabric provide increased protection from cuts and abrasions. They also act as a barrier to high external temperatures in cold weather and insulated thermal inner layer material to help retain the body heat. Gloves. Latex or vinyl, good for exposure to blood or body fluids. Firefighting gloves provide the best protection, heat, cold, and from cuts. Firefighter gloves will not protect you from electrical hazards. You must use your hands freely to operate rescue tools, provide patient care, and perform other duties. This combination will allow you to free. You may wear puncture-proof leather gloves with latex underneath. This combination will allow you to free use your hands with added protection from blood, body fluids. And remember that latex and vinyl gloves are considered medical waste and must be disposed of properly. Leather gloves must be treated as contaminated material until they can be properly decontaminated. Your helmet, common sense, wear it all the time for falling objects. Make sure your chin strap is tight. Construction helmets won't help in this kind of situations. Minimal impact protection. Your boots must be water resistant, fit well, flexible, and comfortable so you can walk long distances. Cover and protect your ankles, keeping out stones, debris, and snow. Must protect you from the cold. Leather is the best. However, other materials such as Gore-Tex, water repellent fabric are also very good. They must also have traction, lug type soles, may grip well in snow, but they become very slippery when caked in mud. You may develop painful blisters if your feet slip around in your boots. Boots will be puncture resistant. It may be difficult to attain a good fit with firefighting boots. Shoe inserts or sock layering may be needed for a comfortable fit. Make sure the tops of your boots are sealed off to keep rain, snow, glass, and other materials out. Eye protection, common sense. Ear protection, wearing soft foam, industrial type earplugs usually provides adequate protection. Skin protection, protect your skin, applying sunscreen. Violent behaviors, behavioral emergencies. It might not be possible for you to gather all information that the question suggests in behavioral emergencies, but sometimes a patient who is expecting a behavioral emergency will not respond at all. In those cases, the patient's facial expressions, pulse, and respirations, tears, sweating, and blushing may be significant indicators of his or her emotional state. The following principles determinants of violence, though not intended to be the only one specifically looked for, are of value for an EMT basic: past history, posture, vocal activity, physical activity, immunizations, annual health examination should be required, a history of all your childhood infectious diseases. If you have not had one of these diseases, you must be immunized. The Center for Disease Control and Prevention, OSHA, OSHA, has developed requirements for protection from blood-borne pathogens, Hep B, and human immune deficiency viruses. An immunization program should be in place in your EMS system. I mean, I got a bit of a mosquito. What the fuck? Oh. Recommended immunizations include TD boosters, measles vaccine, rubella vaccine, mumps vaccine, influenza, and hepatitis B vaccine. Testing should be repeated every year. Definite advantage. This is when your health record will be valuable. If you have already had a disease or been vaccinated, you are not at risk. However, you will not always know whether a patient has a disease. Therefore, you should always follow the BSI techniques if there is a possibility of exposure to blood or bodily fluids.